Hi, it's Dr. Angela Cortal here, and I wanted to talk a little bit about ligament-derived pain. So that is pain where it is coming from ligaments, not necessarily the joint, not muscles, trigger points, fibromyalgia. I'm not talking about any of that. I'm talking specifically about pain coming from ligaments. And the reason for this is because I see it so commonly. I am probably making a new diagnosis several times a day in office. That someone that has had a chronic lingering pain has not really responded to other types of care. The imaging comes back normal. If this is you, you know what a rigmarole all that is. And when I'm evaluating for pain coming from ligaments, actually finding quite a few. And I wanted to start with sacroiliac ligaments, or what we can call SI ligaments for short. So here's one of the SI joints right here. Here's the other one. Mr. Bones is being a great model. This is actually not my skeleton as Dr. Aiken, so thank you, Dr. Aiken. Okay, getting back to our SI ligaments. If I turn the skeleton around, you can see we got two hip bones here and the sacrum. This is the front part of the joint. Going back around to the back again. Here we go, nice sacrum. It's kind of a triangle-shaped bone here. The whole spine sits on it. And we got our two hip bones again here. So we got two SI joints, a left one and a right one, and this is the posterior side. So these posterior, both the anterior and the posterior side are held together by a whole swath of ligaments. And we can think of this like the connective tissue mortar that's holding the bricks, the bones together. Although this is just bones, imagine material all over here, and it's holding these bones together. If the ligaments wouldn't be there, the bones would just fall apart. So they're very integral to this area, and I pick up on a lot of SI pain related to past injuries, and that injury can be any number of things. Sometimes it's a hard fall on the bottom. I have a curious number of patients that have fallen from horses, based on how many patients I have falling from horses and getting hurt. Horses sound really dangerous. I like horses, but that sounds dangerous. Falling off of ladder, falling off of trees, slipping and falling in ice. Oregon can be very sneaky with our freezing rain in the wintertime. And also even just childbirth. Nothing traumatic, so to speak, needs to even happen, but just that extreme stretching of those joints that happens just naturally during the labor and delivery process can also leave this tissue weakened. So I just wanted to bring this up as one example of a very commonly underdiagnosed ligament injury. So if you are not really, if you have not been diagnosed or treated that you think is appropriate and has really worked for you, if you have any pain in this area, maybe it was misdiagnosed as low back pain, maybe it was misdiagnosed as sciatica, but it's not a shooting nerve pain down the legs, it's right in this region, kind of these back pocket areas of the posterior, then I highly recommend checking to see if SI ligament pain is a factor for you.